Hello and welcome to Health Talk. I'm Dr. Manny. Summer brings on mosquitoes, and these days Zika is on the brain, particularly for those looking to start a family. That's because mosquitoes can carry the Zika virus, which can cause microcephaly in babies, causing brain damage. Now, I deliver babies for a living, and I deliver babies with this condition. It's very difficult and very serious diagnosis. OBGYNs like me urge women trying to conceive and pregnant women to avoid Zika-infested areas. But what about the guys? Joining me now to talk about the other side of the equation is Dr. Brian Levine. He's an OBGYN and infertility specialist. Welcome. What do we know about the effects of Zika in pregnancy?
So fortunately, unfortunately, we all know the word Zika, but we still just don't know what it's going to do in pregnancy.
Right.
We know that in those people who are infected during pregnancy, they run the risk of having a baby with a small head when it's delivered, called microcephalic babies.
Right.
Unfortunately, those babies who are born have neurological complications, and we don't know how long those are going to last for. And that's where we unfortunately still are today. We're still trying to figure out what is the effect of Zika.
Now, in my intro, I said that you were going to explain the other side of the equation, which is men.
Correct.
Right? We talk about women, pregnancy, not avoiding those hot areas, but what about the guys? What's the problem with the guys?
So this is the thing that most people still don't realize, even today, 18 months after we started talking about Zika, is that men can be asymptomatic carriers of Zika virus. What we know so far is that if we were to look at a semen sample from a man who was infected with Zika, 3 months later, we could see evidence of infection in his semen. In fact, they've seen RNA as much as 6 months later after he's been infected. So we have lots of guys who are picking up the virus and are transmitting it potentially to their partners that are trying to get pregnant, or to people who might be getting pregnant in the future.
Right. So as far as you know, you mentioned 6 months. How long do you think a guy may carry a viral load in his body? Let's say you think it's going to be beyond 6 months?
So it's hard to say. I mean, there's very few studies out there, right? I mean, you originally said this. There's just so little research, but papers come out every day.
Every day.
So there is one paper that says 180 days it's been recognized in seminal fluid, but that's one paper.
Now, in your practice, you have one of the most prominent infertility practice in the country. A lot of people are, I guess, freezing their sperm. Especially if they say, "Look, I'm going to go on vacation to the Caribbean for 2 weeks with my newlywed, and I want to freeze my semen in case we want to have a baby within those 180 days or even 6 months." So tell me about that program.
So I never expected this to happen, and I don't think this is a New York phenomenon. I think this is a national conversation about the risks of Zika.
Right.
We are finding that people, when they're booking their trips to the Caribbean, are also booking their trips to the fertility clinic, because we know that the best way to prevent Zika transmission from man to woman is to freeze your sperm ahead of time so that you can't transmit it. But what we're seeing is that lots of people are getting infected, even here in New York City, where we don't have mosquitoes biting you yet with Zika, because their partners traveled somewhere. So Zika is a sexually transmitted infection, and that's what the conversation has to start to become.
Right. So, okay, so let's narrow it down, because I want to give some concrete advice to couples that are now looking at this. So let's say me and my wife, we're going to come to you because you're an OBGYN and you know this stuff very well. And I said, "Doc, we're thinking of having a baby in the next 6 months. What advice would you give my wife and would you give me in regards to preventing not getting exposed to the Zika virus?"
So this is the question we get every day.
Right.
So we tell people, first and foremost, avoid travel to a Zika region.
Right.
If you want to avoid getting Zika, avoid going to Zika is what I always tell them.
Right.
Second, if you have to travel, yes, freeze your sperm ahead of time. Third, recognize that you don't have to have the symptoms of Zika to be infected by Zika.
Right.
Only 20% of the people who get infected actually get those symptoms of Zika virus itself. And fourth, I tell people, is have an open, honest conversation. If you have a business trip that's going to take you someplace, check the CDC map, talk to your boss. Maybe you could avoid that trip.
Right. Now, the last question, and just to put it all together. Let's say I didn't come to you for this kind of information, and I really was not paying attention real good as to where I'm going. People that now find themselves in haven't traveled, let's say, to an area and are either newly pregnant or about to get pregnant because that was their plan. What do we tell them? What's the protocol for that?
So the protocol for them is to avoid going to that region. If they did,
but they already went. I'm just saying they didn't know.
But if they did go to that region, is to make sure that you tell your OBGYN so that they can start the screening protocol.
Right.
If they turn positive, the screening protocol could involve regular ultrasounds at maybe even 2-week intervals to look for neurological development if anything's going on. But most importantly is our lab testing has gotten really good. Right, so we can actually look for previous infection and acute infection.
Right.
So have this conversation with your OBGYN.
Okay, so there's a plan here.
There's a plan and stuff to do.
Well, thank you so much for coming. This is great information and very important as the summer develops more and more, and there's more travel and more mosquitoes for sure. And if you have a health question, tweet me at Dr. Manny on Fox. Until next time, I'm Dr. Manny.